What about risk factors such as alcohol, smoking and stress? Stress, I mean that, it probably results in other factors or habits which could result in possible risk factors increasing. So alcohol as well as smoking and stress.
Okay, so let's address all three sort of separately. The first one is easy, smoking. So when we talk about lifestyle modification, we always talk about being moderate. But this is one area where it needs to be zero. So smoking, tobacco consumption, including vaping, which especially the youngsters are into these days.
So vaping is a big risk.
Absolutely, and that needs to be zero. There is no moderation. Sometimes patient asks, Doc, I used to smoke 10 cigarettes a day. Now is it okay if I smoke 5? I say it's like asking me, should I jump from the 10th floor of a building or the 5th floor, right? So the answer is no. Smoking has got to be zero. Then we come to alcohol. Now, this is where it gets interesting because kind of for a long, long time, even the Heart Association recommendations were that moderate alcohol is not bad for your health, red wine is good for your health. But keep in mind that a lot of these studies were also sponsored by red wine growing countries. And today, the research has shown is, ironically, that even a little bit of alcohol is not necessarily good for you. So I have a simple line for my patients. I will never encourage anyone to start drinking, right, for heart health. If they are drinking and they're doing so in moderation, and we need to define moderation, then I would allow them, but certainly not to start drinking. Your last point was stress. Now, stress and heart disease has a sort of a bi-directional relationship. As you said, one is the indirect effect of stress. Because someone is stressed, they may say, oh, I need to smoke, I need to have a drink, I don't have time to exercise, right? So that's an indirect. But we know that there are direct effects of stress on the heart due to the hormones kind of release. So we know that stress can lead to heart disease, stress, anxiety, depression. And heart disease itself can also lead to things like anxiety, depression, and stress. The only problem with stress is we cannot measure it. Like he said, we can tell you your pressure should be 120/80. We can say your fasting sugar should be below 100. But there's no number to stress, right? You're a financial channel. So if a white-collar worker suddenly sees the Sensex drop, his stress level is going to go through the roof. But the blue-collar worker, it's not going to affect him. But if the blue-collar worker loses a 100-rupee note on the way to work, it might affect him much more, than his boss might. So stress we cannot measure, but we definitely know that it's not good for your overall health and heart health and needs to be kept under control.
Managing stress is a whole different conversation.
But if I may add here, stress, I agree with what Dr. Ashish said, that stress is a non-quantifiable risk factor. It's not the stress that matters. It's the reaction to stress that matters. There are certain people who can take stress and react to it very differently. There are certain people who react to it in an absolutely negative manner also. So that reaction to stress is what releases the hormones, and that's where it has a direct effect on the heart and other organs.
For more news and updates, all you need to do is follow CNBC TV 18 on all of our digital platforms.